Mr. Palani, aged 46 years, supposed to be a physically fit person, a known hypertensive on treatment, presented to Kauvery Hospital, Hosur, with a history of breathlessness lasting for 4 to 5 days. On arrival at the emergency department, he was found to be in acute heart failure, wherein the cardiologist at the Hosur Hospital picked up the cause of the heart failure. The cause of the heart failure was an acute leakage of the valve. It's known as acute mitral regurgitation, which had happened because one of the apparatus of the valve had given way, that is ruptured, leading on to leakage of the blood. So this had created a lot of pressure on the heart and the lungs, leading on to acute onset of the heart failure. This had affected the multiple organ systems in the whole body. So all the organ systems like kidney, liver were affected. They were not optimally functioning. So initially they stabilized him and then they transferred the patient to Kauvery Hospital, Bangalore.
Couple of weeks back, he just got chest pain. So he thought maybe it should be gastric. He didn't tell to anyone about it. So what he did, he just went to the local clinic. They gave him tablet, all gastric tablet and everything. He took 1 or 2 days he was fine, and after that again he had chest pain. So that is when he actually opened up to the family, everyone, saying, I'm actually having some pain. So what they did, they took him to the nearest hospital. So they just again took ECG and everything, and they told he's normal, nothing major about it, and they got him home. So one fine day, what happened? He was doing his normal day-to-day routine. He felt giddy all of a sudden, and he just fell down. And then he started sweating so badly, and his full clothes was drenched with sweat. So everyone got panicked at that point of time, and they didn't know what to do. Then suddenly one of our family friends suggested, saying, you take him to the Kauvery Hospital, which is in Hosur. They took him to that hospital, and when he went there, he was full unconscious. Doctor told hope not surgery is very important for him at this point of time, because he was very, very critical. And the doctor over there also had told, saying that, he has only 20% chances to survive. So, at that point of time, he asked very small kids, thinking about that family and everything. He got very panicked about it. The entire family got panicked, and we didn't know what to do. We were very helpless. The only hopes we had is with the hospital. Then the doctors over there arranged for an ambulance, and they got him here.
Once the patient arrived in Kauvery Hospital, Bangalore, we took a stock of the situation, assessed the patient, and had investigations at our disposal. We had to make a decision that this patient requires an immediate surgery. There is no other way this patient will survive if he doesn't undergo surgery, albeit this surgery was also very high risk because of multiple organ system dysfunction.
After discussing with family, we had no option. The only option was to go with the open heart surgery, and then the surgery started. They kept us informed about what is going to happen. But one thing which I wanted to call out, which I liked very much, is the doctors and the nurse kept on contacting us for everything. So usually what I have seen personally is, until unless you go and talk to the doctor or you go and talk to the nurse, they don't give you update on what's happening.
We proceeded with emergency open heart surgery, wherein we found that the apparatus of the mitral valve had given way, leading on to massive leakage of the valve, which had put a pressure on the heart and the lungs of the patient. So we replaced the valve and came out.
Doctor told it's critical, but in 6 hours after operation, he opened his eyes. Next day, he started talking, slowly moving. Doctor told it's difficult for him to walk. It will be a little difficult, but he started walking, and slowly doctor told we're also giving him food. So, all these things, hearing all of these things, for us it was actually a very big boost, and to be very honest, I would say it's a miracle. And I really want to thank both the doctors who have been closely, giving us update. Every day morning, as soon as they come to the room, they call us family and they say that progress. So the old hospital, they told 20% is the living chance. Then the doctor gave us assurance of 80%. So he's 80% cured now, only 20% risk is there. So that's a drastic change from 80% risk to a 20% risk. So we all were very happy.
The patient took a couple of days to tide over this emergency surgery, but once the tide started turning in his favor, he made a very rapid progress, and then he got discharged in the next couple of days. At discharge, the patient was doing very well with his heart function and the lungs and other organ system had recovered near normal.
This is the first time I've come to Kauvery Hospital, and witnessing this kind of a progress which we didn't expect is a great achievement. We all are very happy with the treatment what is going on, and the medication whatever they're giving. It's very clean, very nice, it's very organized basically.
இப்போ என் வீட்டுக்காரரு நல்ல மாதிரியாக ஆப்ரேஷன் முடிஞ்சு நல்ல மாதிரியாக வீட்டில் இருக்கிறாரு, நல்ல மாதிரியாக எங்களை பார்க்குறாரு. டாக்டருங்கெல்லாம் கோஆப்ரேட் பண்ணாங்க. இங்கே இருக்கிற டாக்டருங்க எல்லாம் இன்னும் தட்டி கொடுத்து எங்கள் வீட்டுக்காரன் நல்ல மாதிரியாக காப்பாற்றி நல்ல மாதிரியாக கொடுத்தாங்க. அது எங்களுக்கு ரொம்ப நன்றி.
So I just want to thank the doctors, and a big salute to both the doctors who's got my uncle back to normal now.